If you are a man over 60, there is something you should know. More than 70% of men in this age group experience at least one urological problem, whether it's an enlarged prostate, difficulty urinating, or problems with intimacy. Most men ignore the early warning signs. They think it's just part of getting older. But by the time they seek help, the problem has often advanced, making treatment harder and quality of life worse. The good news? You are not powerless. By understanding the 5 most common urological problems that affect men after 60, you can take control of your health, act early, and prevent complications. I'm Dr. Berman, and in this video, I will walk you through these conditions one by one using the latest scientific research. By the end, you will know what to look for, when to take action, and how to protect your health. Problem 1. Benign prostatic hyperplasia, BPH. Let's start with the most common, benign prostatic hyperplasia, or BPH. This is the non-cancerous enlargement of the prostate gland. Prevalence. Studies show that by age 60, about 50% of men have BPH. By age 85, that number rises to 90%. Symptoms: difficulty starting urination, weak urine stream, frequent urination, especially at night. Some men feel they can never fully empty their bladder. Why it matters? While BPH itself is not cancer, it can seriously impact daily life, sleep quality, and even lead to kidney problems if untreated. What causes it? As men age, hormonal changes, particularly involving dihydrotestosterone, DHT, cause prostate cells to grow. The prostate presses against the urethra, making urination harder. Treatment options: lifestyle adjustments, reducing evening fluid intake, limiting caffeine and alcohol. Medications: alpha blockers and 5-alpha reductase inhibitors can shrink the prostate or relax muscles. Procedures: minimally invasive therapies such as UroLift or TURP surgery are options when symptoms are severe. The key is early recognition. Don't ignore waking up multiple times at night to urinate. It's not just normal aging, it could be BPH. Problem 2. Male intimacy health, ED. The second major issue is related to male intimacy health, commonly known as ED. Prevalence: about 40% of men at age 60 experience some form of difficulty in maintaining function. By age 70, nearly 70% are affected. Why it matters? This is not only about private life. It is often an early warning sign of cardiovascular disease. The blood vessels in this area are smaller than those in the heart, so circulation issues show up here first. Causes: vascular problems such as high blood pressure, diabetes, and high cholesterol. Hormonal imbalances such as low testosterone, neurological conditions, side effects of medications, treatment options, lifestyle, weight loss, regular exercise, quitting smoking. Medications: PDE5 inhibitors, well-known tablets used for this condition. Hormone therapy for men with low testosterone, advanced options, external devices, medical injections, or implants. The important takeaway: if you experience this condition, don't just look for a quick solution. See it as a sign your overall health, especially your heart, may need attention. Problem 3. Prostate cancer. Next, we must talk about prostate cancer, one of the most feared urological diseases in older men. Prevalence: prostate cancer is the second most common cancer in men worldwide. In the United States, about 1 in 8 men will be diagnosed during their lifetime, with most cases after age 65. Why it matters? While many prostate cancers are slow-growing, some can be aggressive and life-threatening. Risk factors: age. Risk increases after 60. Family history. Ethnicity: African American men have higher risk. Diets high in red meat and low in vegetables. Screening: the PSA blood test and digital rectal exam are common tools. Controversy exists, but for men with risk factors, screening can save lives. Treatment options: active surveillance for low-risk cancers. Surgery: radical prostatectomy. Radiation therapy. Hormone therapy for advanced cases. Key message: early detection saves lives. Men should have informed discussions with their doctors about screening, especially if they are over 60 or have family history. Problem 4. Urinary incontinence. Another common and often embarrassing problem is urinary incontinence. Prevalence. Up to 20-30% of older men experience some form of incontinence. Types: stress incontinence, leakage when coughing, sneezing, lifting. Urge incontinence, sudden strong need to urinate. Overflow incontinence, bladder doesn't empty completely. Causes: prostate surgery, neurological conditions, Parkinson's, stroke, overactive bladder syndrome. Impact: beyond hygiene issues, incontinence affects social confidence, emotional health, and quality of life. Many men stop going out or exercising because of fear of leakage. Treatment: pelvic floor exercises, Kegels, yes, for men too. Bladder training and scheduled voiding, medications for overactive bladder, surgical options for severe cases. Remember, incontinence is not just part of aging, it's treatable, and you don't have to live in silence. Problem 5. Urinary tract infections, UTIs, and bladder disorders. The fifth issue is urinary tract infections and other bladder disorders. Prevalence. While UTIs are more common in women, older men, especially those with enlarged prostates, are also at risk. Symptoms: burning during urination, cloudy urine, frequent urge to urinate, fever in severe cases. Why men over 60 are at risk? Incomplete bladder emptying due to BPH creates an environment where bacteria thrive. Bladder problems such as overactive bladder or bladder stones also increase with age. Treatment: antibiotics for bacterial infections. Adequate hydration, addressing underlying causes like BPH. Takeaway: never ignore urinary pain or fever. Untreated infections can spread to the kidneys and become life-threatening. Prevention and lifestyle advice. So how can men protect themselves? Diet: eat more fruits, vegetables, and whole grains. Reduce processed foods, red meat, and excessive alcohol. Exercise: regular physical activity improves circulation, hormone balance, and bladder control. Hydration: drink enough water, but reduce fluids close to bedtime. Medical checkups, annual prostate and urology screenings after 60 are critical. Mental health: stress and anxiety can worsen urological symptoms. Mindfulness, counseling, and social support are powerful tools. Let's recap. The 5 most common urological problems in men over 60 are benign prostatic hyperplasia, BPH, erectile dysfunction, ED, prostate cancer, urinary incontinence, urinary tract infections, and bladder disorders. These conditions are common, but they are not inevitable. With awareness, prevention, and modern treatment, men can continue to live healthy, confident, and fulfilling lives. So, if you or someone you love is experiencing symptoms, don't ignore them. Talk to a doctor, seek help early, and take control of your health. Thank you for watching. I'm Dr. Berman, and this has been your guide to the top 5 urological problems in men over 60. Stay healthy, stay strong, because every stage of life deserves dignity and vitality.